Vortioxetine, presented by Nate Covert and Austin Forsyth. Depression is not just sadness.
Depression is complicated. Really complicated. Have your typical antidepressants left you feeling the same, with no clear signs of improvement?
Vortioxetine may help you take a step forward in helping you deal with depression when other antidepressants seem to fail. Ask your healthcare professional if vortioxetine is a change you need in your antidepressants.
Stay tuned for facts and research as to why vortioxetine may be right for you. Vortioxetine is indicated for the treatment of major depressive disorder.
It is only recommended in people who have not improved significantly on 2 other antidepressants.
Major depressive disorder causes symptoms that interfere with a person's ability to work, sleep, eat, and think.
These symptoms include sadness, helplessness, hopelessness, difficulty concentrating, memory lapses, and the inability to make decisions.
These cognitive functions are vital to a happy and healthy life. The trade name for vortioxetine is Trintellix or Brintellix.
Pharmacokinetics.
Administration. Vortioxetine is taken orally in tablet form daily. Typical dosing starts at 10 mg daily and may be increased. Absorption. The maximal plasma vortioxetine concentration after dosing is reached within 7 to 11 hours post-dose. Absolute bioavailability is 75%. No effect of food on pharmacokinetics is observed.
Metabolism. Vortioxetine is extensively metabolized primarily through oxidation via cytochrome P450 isosome CYP2D6, CYP3A4/5, CYP2C19, CYP2C9, CYP2A6, CYP2C8, and CYP2B6.
Terminal half-life of vortioxetine is approximately 66 hours. Elimination. Following a single oral dose of vortioxetine, approximately 59% is eliminated in urine and 26% is recovered in feces as metabolites.
Pharmacodynamics. Vortioxetine binds with high affinity to the serotonin transporter, but not to the norepinephrine or dopamine transporters.
It increases serotonin concentrations in the brain by inhibiting its reuptake in the synapse, and by modulating, or activating certain receptors while blocking or antagonizing others, certain serotonin receptors. These characteristics put it in the class of atypical antidepressants, known as serotonin modulator simulators. Off-label uses. Treatment of anxiety. Anxiety disorders form a category of mental health diagnoses that lead to excessive nervousness, fear, apprehension, and worry.
Many medications originally approved to the treatment of depression are also prescribed for anxiety.
These antidepressants have been used to treat generalized anxiety disorder, obsessive-compulsive disorder, panic disorder, social anxiety disorder, and post-traumatic stress disorder. Serotonin, which is a naturally occurring chemical or neurotransmitter in the brain, is associated with the regulation of mood and is considered to be imbalanced in those with anxiety. Like many antidepressants, vortioxetine increases serotonin activity by blocking the reuptake of serotonin in the brain. This increase in serotonin might help balance out levels of brain chemicals to help improve symptoms of anxiety. But unlike other antidepressants, vortioxetine also binds to and blocks certain types of serotonin receptors in the brain. Vortioxetine is not FDA approved for treating children. However, some doctors may prescribe vortioxetine off-label to treat depression in children. Why take vortioxetine? The study. The 8-week double-blind multinational study compared the efficacy of vortioxetine at 10 mg and 20 mg per day against placebo on both cognition and depression in 602 adults with major depressive disorder, aged 18 to 65 years. Both doses of vortioxetine significantly improve cognition scores and depressive symptoms compared with placebo. Roger S. McIntyre, study researcher and professor of psychiatry at the University of Toronto in Ontario, Canada, and psychiatric advisor editorial board member, said, "Vortioxetine differs from selective serotonin reuptake inhibitors in its multimodal effect on serotonin transport and reuptake. The relevance is that it's the first antidepressant to affect the domain of cognition independently, a domain we struggle to treat well in depression."
That is its ingram. There is little evidence that any other antidepressant, other than vortioxetine, improves cognition independent of its effect on depressive symptoms, he said. On a side note, Dr. Roger helped develop vortioxetine, but we'll take his word for it. He's a doctor. Thanks to the SVU football team for sponsoring this message. Go Knights!